Hello, my name is Erica Lopez, and before this course, I define mental illness as something in your mental state that prevents you from functioning normally at a physical, mental, or emotional level. Now, there has been a timeline to to my definition of mental illness. If you would have asked me when I was 14, I probably would have said something along the lines of somebody who is on drugs, somebody who was born that way. Now, I think there are two limitations to my definition. The first is that my definition is very broad. It doesn't include the people who don't appear to be suffering from mental illness, but probably are. Just because you don't act, and I use this word lightly, crazy, doesn't mean you might not be suffering from a mental illness. The second limitation is that not everybody has the educational background that I have. I have been in school for, I'm working towards my BA in sociology, and mental illness has been brought up a lot consistently throughout my time at Fresno State. Therefore, I think that is one limitation to my definition. Not everybody has access to the education that I have. My definition, I feel, is pretty relatable to the ones that I have read. Um, I actually used mediums such as Facebook and Instagram to ask people what I say the words mentally ill, what it means to them, or what do they think of. Somebody, his name is Andrew, he said that mental illness is somebody who is mentally ill, someone who is not well enough to make personal decisions or choices, and that requires medical, psychological treatment. Somebody else said, somebody who is mentally ill is more than not someone whose mind and emotional state is not stable. Oftentimes, they are suffering from common disorders like depression, anxiety, schizophrenia, or any other illnesses associated with the mind. They're in control of who they are, but their mind is vulnerable to change based on their situation, such as changes in mood or location. All of these, I feel, are synonymous in a way, and they ring for empathetic changes. However, I feel sometimes there are situations where people will judge people who are mentally ill, especially if you come from a background such as where you are a minority. Now, I want to take into consideration that not everybody, most people don't come from the same town. I myself I migrated into the United States from Zacatecas, Mexico. If somebody is mentally ill in Mexico, they don't want to touch you, they don't want to be near you. You are almost taboo to the human race. And I think that oftentimes people, not just in Mexico, but also here, label people who are mentally ill without actually understanding what caused this illness or why they are mentally ill. Now, when I think of why people are mentally ill, two factors come to mind, and it's nature versus nurture. Obviously, there are people who are born with a chemical imbalance in their brain. There are people whose mothers did drugs, maybe. So that is a biological, nature caused mental illness. However, there are mental illnesses that are caused by the lack of nurture, by the lack of resources, by your social location. One of the predominant factors that I believe in how you will be treated is regarding your mental illness is what race or ethnicity you are. If you were white, um, the chances are you're probably going to be around. You have the likelihood of you being around people who will give you these resources or try to help you or empathize with you is greater. However, if you were a minority, those chances diminish a little bit. So the difference in how people are treated, whether they are white or whether they are a minority, is a really big one. Take, for instance, in the article titled Whiteness, Criminality, and the Double Standards of Deviance in Social Control, there is a statement that says that a closer examination of the mechanisms of social control reveals that the type of social control exerted has much less to do with the deviation in question and much more to do with the demographics of the deviant. So if you are mentally ill and you also happen to be Black, the intersectionality of your being causes people to judge you rather than to try to help you. However, if you are white and you're also mentally ill, people will more likely want to empathize with you. They will want to treat you like if you were the victim. In from the Mental Disorder and Violence book, they also say discharged patients are more likely to be accommodated in poor localities. And I think that that is another huge factor of why people become mentally ill if they're not nurtured correctly. If you live in a poor neighborhood and there are drugs around your neighborhood, if you were born in a gang, into a gang, then the chances of you becoming mentally ill because of the damage done by drugs to your brain can definitely increase. These are factors that do increase the likelihood of you becoming mentally ill in your adulthood. Now, to wrap it up, I do think that being mentally ill, it should not be seen as taboo. We should have more resources across the world to help people who suffer from mental illnesses to know that they are not abnormal. Oftentimes, if you are mentally ill, even if it's in the least, like I don't know if there's a spectrum, but they will label you as abnormal. And I think stepping away from the fact that everybody has a story leads to judgmental situations. However, I think that the way to stop that is to stop listening to what people tell us and start becoming more informed.